Good morning. Thanks as always to Jay and Vicky for interpreting this morning. Before we start, I'd like to open with a moment of silence for Deputy Sheriff Donald Gilreath III. As many of you know, Deputy Gilreath lost his life. He worked in jail services over for the sheriff's office. He lost his life to COVID. He leaves behind a wife and 3 kids. From all accounts, he was a wonderful, friendly young man. And so today we are heading up to the funeral this morning, but today we'd like to honor him with a moment of silence at the top of the briefing. So please join me in a moment of silence. Thank you. So, today we are going to focus on equity and the equitable distribution of vaccines here in Hamilton County. So Greg Kesterman, the health commissioner, gave us a presentation at our meeting yesterday. He and his team have come up with a plan to make sure that we are doing our best work in Hamilton County. So I'm going to let him go into the detail of that. Commissioner Reese has also joined us today. She's going to talk about some of the help that is available right now for people that are still struggling in the midst of the COVID economy. First, we're going to go through the numbers, though. So total numbers for positive cases in Hamilton County stand at 71,245. Hospitalizations are at 2,509. And deaths stand at 913. I'm going to take a minute to talk about the number of deaths. So as has been widely reported, the Ohio Department of Health had been erroneously underreporting deaths until last week. And so that impacted our numbers here in Hamilton County. And so as a result, our numbers have been reported to be lower than they actually were. So to be clear, the new deaths Serena, that are included in the 913, they're not new as of last week. They're new as to how many deaths have been counted here in Hamilton County. It's unfortunate that the mistake was made, but the new corrected number does give a stark reminder of just how deadly the disease can be, because the deltas that I always refer to, the increases from last week, when it comes to positive cases, that change is 1,387. That's a very low number, relatively speaking. The number of hospitalizations have increased by 28 from last week. And the number for deaths is 426. Obviously, we have not had 426 deaths in the last week. That is simply putting those numbers into the system to get us to the correct number as we continue to report out. Something to note, though, hospitalizations in the county, 2,500. Deaths, almost 1,000. So that gives you an idea of the dangerous situation once someone has to be admitted to the hospital and how tenuous that situation is. So on to vaccines. So in the state of Ohio, as has been reported, only about 5% of the people who have been vaccinated are African American. The number in Hamilton County is closer to 11%, so better than double what the state is doing, but that does not reflect our demographics. In Hamilton County, the number of African Americans is closer to 25%. And so as you can see, we've got work to do, and we know that we can do better. So while the governor has said that improving equity is a priority, we in Hamilton County commissioners and the health commissioner have also said equity is a priority. So yesterday, Greg presented the plan, but we have been working with the city, with the health collaborative, with the hospital systems, with those that are distributing vaccine down here on the ground, to come up with our own plan, to present that to the governor to say, we're ready to go. We just need the vaccines to do it, but we are ready to go. And that plan has been submitted to the governor. A nice collaborative effort between the city, the county, and the hospital systems. So fundamentally, the scarcity of vaccine, combined with the large number of private providers who are administering the vaccine, have created this kind of race for appointments, and some residents are falling behind. So as more vaccine becomes available, and we have heard this nationally and through the state, that more vaccines are going to become available. So what we are asking the governor to do is give a large share of those additional doses to public health, both at the county level and at the city level, because public health is traditionally and historically the agency that is the safety net for folks in this community, folks that are at a disadvantage. And so we are hopeful that he will heed that and give us additional vaccines as more become available. I've also spoken to my colleagues throughout the state, county commissioners throughout the state, and we are also collectively putting a plan together to make sure that the governor understands that counties are on the front line of making sure that we've got equitable distribution of vaccine. And so we are also offering a plan collectively by the end of the week. So with that, I am going to turn it over to Commissioner Reese. I do want to say that, as I mentioned, the visitation for the deputy is this morning. And so Commissioner Reese and I are heading up to that. And so we are going to be leaving a little bit early today. I tried to abbreviate my comments. I'm not sure how well I did. But we're going to be leaving a little early. And so you may see us bug out during the Q&A. But as you all know, Greg Kesterman generally gets most of the questions anyway. And so he will close it out if the two of us have to leave. Vice President Reese.
Thank you, Commissioner Driehaus, and all the work that is being done as it relates to COVID-19 from the health side, and certainly excited that we were able to have a plan that can be submitted. I want to also thank those. I had a virtual town hall on last week with Governor DeWine, NAACP President Jill Mallory, Dr. Lofgren from UC Health, Renee Mahaffey Harris from Closing the Health Gap, and Commissioner Kesterman, who you'll hear from in a minute. And while we did discuss the issue of equity, which echoes what Commissioner Driehaus has said directly to the governor, we also asked about the issue dealing with our COVID-19 Economic Recovery and Relief Task Force. One of the issues that we were able to bring up is asking the governor to give us the authority here at the county level to be able to reduce the sewer portion of the water bill. There is a state law that prohibits us to have the flexibility. He was very interested in that, and today we are announcing that we're going to be sending a letter directly to him. He's asked us to send him a letter directly to him to see if this could be included in his budget at the state level. If that does happen, that will be huge, because at the state, when the budget is done, it has a timeline. A bill doesn't have a timeline. So we see this as a emergency issue for COVID-19 to help reduce the rate for the ratepayers here in Hamilton County. And again, he was interested in it and has asked us to submit our request, and we're doing that today. In addition, there continues to be help. As mentioned last week, we did receive $15 million from the Treasury Department for rental assistance. That will be rolled out no later than April, with coordination with the county and the city, so that we'll have a one-stop website, which is being developed as we speak. But in the meantime, we have help right now for people who do need rental assistance. And you can go to our HamiltonCountyOhio.gov. HamiltonCountyOhio.gov. There is a red banner at the top. Click that banner, and it will take you to getting for you to be able to get registered right now if you need help with rental and utility assistance. It gets you right to the application. In addition, for those who may not be tech savvy, there is a phone number, and you can call, or you can also text the number 513-207-4954. 513-207-4954. So we've added the text component to this. In addition, Talbot House, who we have provided CARES Act funding to, also is accepting applications as well. We also have dealt with outreach for those who are unemployed. So far this week, we've sent out 15,000 emails to those who are unemployed to let them know about the services that we have available through CARES Act funding. So we are doing outreach to try to reduce the bottleneck that we have being able to get these services directly to people. In addition, the county is funding a $600,000 CARES Act for tuition program training with CARES. And there's a $5,000 cap per student. Now, this focuses on commercial driver's license and information technology. And again, you could go to our website and get that information. There's money available at a number of locations that can help with that. So we are moving in the right direction. We are coordinating, and again, we are sending the request directly to the governor to ask for a possible amendment to the budget that would allow Hamilton County to have the flexibility to be able to reduce the rate, some of the pressure on people for the biggest part of their water bill, which is the sewer part of it. So that is our report for now. We have help right now. Please go to that website, and in a short time, we'll be coming with a one-stop where you can go and get everything you need, even in a mobile way, as well as a one number. So with that, I will turn it back over to Commissioner Driehaus.
Thank you, Commissioner Reese. And now I'm going to turn it over to Commissioner Kesterman.
Good morning. There has continued to be great trends with many of our metrics. So I've been here now 3 weeks in a row saying that it's really good news. We continue to see decreasing cases, decreasing hospitalizations, decreasing intensive care unit admissions, and most excitingly, increasing vaccinations here within our county. I continue to want to reemphasize that one of the tools that we have to combat COVID-19 is getting tested. If you're sick, we continue to ask you to stay home and get yourself tested. There are a lot of great opportunities in Hamilton County, and those can be found on our website at hcph.org. And a large portion of this testing is through the Test and Protect funding, or the Test and Protect program, funded in large part, or funded by the Hamilton County Commissioners. So really great opportunity. Please continue to keep sick at home. It's super important, and it will continue to drive our cases down and help our community get through this pandemic. Looking at our cases, December 10th continues to be our highest peak. On average, we were seeing about 716 cases per day. Over the last 7 days, our new average is 203 cases per day. So really great news, a significant decline. 203 cases per day is down 100 from where we were at just last Wednesday when I provided this briefing. And so I really believe that the effort of our community, wearing our masks, socially distancing, washing our hands, and keeping sick at home are having a great impact and are continuing to help our community heal from COVID-19. When you look at the total number of cases, minus those that have presumed recovered, there remains about 6,300 known cases of COVID, active cases of COVID within our community. So there still is a lot of opportunity to get sick within Hamilton County. And it's that reason why we need to continue to keep our guard up and be careful and lower our COVID footprint. So as we head out into the community, I ask you still to be cautious. And even though I'm sharing positive news, it's really important not to let our guard down and to get careless with our activities. When you look at our reproductive value, this morning we are at 0.83 for Hamilton County and 0.84. This number continues to drop, which is excellent news. It shows the pandemic is kind of decreasing its footprint in Hamilton County, which is really positive news. In addition, I mentioned our hospitals. Hospitalizations are down. When you look at our region's 14 hospitals, there are about 340 patients within these systems per day. This is down by 100 from last week during this briefing, and significantly down from where we were at in December and January when we were up closer to 800 patients per day. So a great report there for our hospital systems. They're finally getting some relief. Similarly, when you talk about our intensive care units, we have about 115 patients in our region's ICUs, and this is down from about 200 back in January and December. So really, really great news. I want to show one graphic just to portray what Commissioner Driehaus spoke of regarding death data in Hamilton County. As Commissioner Driehaus indicated, Ohio was underreporting deaths. About 4,000 deaths statewide were underreported. This was a result of one individual at the State Department of Health that was responsible for this work. It appears that the work got backlogged and they were unable to verify the data between the vital statistics data or death certificates that were received and the data coming out of the Ohio disease reporting system, which is updated by public health and hospital systems. As a result, the state did a one-time addition of deaths. The graphic on the screen actually shows deaths corrected in Hamilton County over time. So you can clearly see there was a pretty big impact on the number of individuals passing away in Hamilton County in late December and early January. So mirroring kind of the holidays, and we knew our intensive care unit admissions were significantly increased around that time. So I just really wanted to show the corrected data so that you'd have that for reference. And then I'd like to move into talking about vaccine, as there continues to be a lot of excitement around vaccine here. Next week, we found out that there continues to be about 50 providers in our community that will be vaccinating those that are 65 years and older. And we will be getting, as a county as a whole, from the State Department of Health, about 14,000 doses of vaccine. It sounds like additional doses will be also going to Kroger pharmacies as well as Rite Aids, and those are not included in that calculation of vaccine. Hamilton County Public Health will see about 2,300 doses, and we will be working to get those doses out into our community. When you look at our community as a whole, we've now had about 100,000 people vaccinated, representing about 12% of our total population. So we are continuing to make progress. We'd love to have that number higher, and we'll continue to work as we get more vaccine to get that into the community. But I think this is significant progress and really goes to show how many providers are working hard to help our community. Looking at those individuals that are between 80 years, for those individuals that are over 80 years, we've nearly vaccinated about 60% of them. And so that's a great number. We still have work to do, and we know there's still a lot of demand for vaccine, and we will continue to ensure that those individuals have access to vaccine. Same holds true for those that are 70 to 79, about 45% have been vaccinated, and those that are between 60 and 70, about 15% have been vaccinated. I get calls every day from individuals that are 65 and older wanting their opportunity to get vaccinated, and I continue to remind people that there still is a shortage of vaccine, and we are going to continue making sure that we can get that vaccine into the community. But patience is needed. In addition, if you want the best chance to get the vaccine, you do have to use every provider here and try and get your appointment through each of the providers. So if you visit our website, hcph.org, all of the providers are mapped out on our website and listed with phone numbers, and you can learn about how to get that opportunity. So in closing, I just want to reiterate that, vaccine does provide relief to our community. But the simplest tool that we've been talking about since February remains true, and it's the best way that we can protect our community. And it's that social distancing, it's that masking, it's that keeping sick at home and making sure we're washing our hands. Those very basic infectious disease control measures will help our community finish up through this pandemic successfully. So I thank everyone for their hard work, and we'll stop there. Yes, Commissioner Driehaus reminded me that I was also going to speak about equity. Our team is actually working with many partners to ensure that we have equitable access to vaccine within Hamilton County. We're doing this through a few different approaches. First is through communication. We're working with many partners to make sure that we're getting the right message into our community. We are also, I keep mentioning week after week, we are not the biggest provider in Hamilton County for vaccine. So I am working hard to advocate that some of our most impactful partners are getting vaccine. These include our federally qualified health centers. I want to make sure that they get the necessary vaccine to get it into our communities. We are, as a team, also setting up our vaccine clinics in many of our communities that need vaccine the most. Our very first vaccine clinics in Hamilton County were in Forest Park. And you may recall back when the pandemic started, Forest Park was one of the hardest hit communities identified by the governor's office during a press briefing. And so following that same tradition, we are making sure we're bringing vaccine to the communities that need vaccine the most. In addition, my team, we have actually, as an agency, hired a health equity coordinator, and she is working very closely with many communities to make sure that we are able to be the most impactful when we're taking vaccine to these communities. I will stop there and happy to answer any specific questions anyone might have.
Thank you, Greg. We're all abbreviated this morning. It's a little challenging, isn't it? But with that, we're going to go to questions.
Okay, the first question is from John London, and it's for Commissioner Kesterman.
Good morning, John.
Hi, Greg. I have several questions. Let me just ask a couple, and then I can ask some more later after others get a chance. And I want to say, first of all, my questions are in no way to be taken as critical of the work that folks are doing. I know everyone is trying their best, but that we hear from so many people, Greg, who are having difficulty getting signed up for vaccination. So I wonder, besides patients, what advice can you give them about what they should do? And does this unexpected delay in the state's clearinghouse website, which now is going to be weeks of delay, as I understand, make the sign-up process here even worse?
Ultimately, we have created some tools to make it easier in Hamilton County to find out who has vaccine and how to have access to those vaccines. And if you wish to have the best opportunity to get vaccinated, it really does take some time and effort. It means that you have to go to about 7 or 8 different large providers and try back every day to see if they have appointments open. I've heard many successful stories. In fact, I've helped 1 or 2 folks navigate this personally. And it works, but it's difficult. And so the state is, as you mentioned, working on a statewide system, and they will make new providers become part of that statewide system. But until a mass of providers end up in that system, we're still kind of fragmented in Ohio.
And for those who have signed up, let's say with the city website and also with the Hamilton County website, there are some folks who think that that's sufficient. Would you recommend that they move beyond that and sign up with other providers?
Yes, that's correct. On my website alone, we have about 40,000 people that are 65 and older trying to get vaccinated. The good news is when we reach out to some of these individuals, they have already made appointments elsewhere. But as mentioned, I'm only getting next week 2,300 doses. In Hamilton County, there's 14,000 doses available. So if you want to have access to all 14,000 doses and have your best chance to get a vaccine, it's really important that you try the Kroger's and you try the CVS and you try both health departments as well as the hospital systems in Hamilton County. Each provider has their own allocation and their own system set up for registering appointments.
One other quick one, and then I'll step aside and I'll have a couple more later. But, some people are wondering if equitable distribution it's preparatory to getting a much larger distribution and much larger cache of vaccine, if you will. All the clinics aren't even close to capacity of what they can do. I was out at a New Prospect Baptist Church, and I saw the effort there, which was very efficient. And they were telling me they could do a clinic a week if they just had the doses. But some folks are wondering, why set up more and more locations when all have to split up what is very little vaccine right now?
So there's a couple different strategies, and I think honestly, from my perspective, the strategy employed by Governor DeWine and the Ohio Department of Health is to have as many providers trained and ready to go so that we are able to vaccinate as many people as possible when more vaccine comes. The other item that I think is important, when you visit our website and you look at the distribution of vaccine clinics, or if you look at my slides presented yesterday during the Board of County Commissioners meeting, there's a slide that shows that nearly the entire county is within 10-minute drive of a vaccine clinic. And so, it's really important to make sure that we are reaching every portion of Hamilton County with vaccine. And I think there's still more opportunities. And I know that not everyone in Hamilton County has a car. And so we focus trying to set up locations such as the Board of Elections that has significant access to bus lines and public transit. And so while I hear the concern that if we give too much vaccine out in little doses around the county, it prevents us from having larger sites, those little sites are really important to making sure we're reaching every corner of Hamilton County.
Greg, thanks. I'll have additional questions, a couple more a little bit later.
Thanks.
Our next questions is from Corey Sharber, WVXU.
Good morning, Corey.
Good morning, Greg. I have several questions here. Of course, this week the weather has been pretty god awful. I was wondering if you guys have seen any impact as far as vaccines slowing down within the county, as well as testing. Have those numbers been affected due to all of this?
So testing has continued to remain fairly consistent throughout the last several months. I've not seen any shifts. I know with vaccine distribution, yesterday we were expecting a shipment and it did not come. It will come today. So that does cause a little bit of rescheduling and effort on my team's part. Similarly, yesterday we had about 775 patients scheduled to get vaccinated. And my team, working early on, decided that it was probably best to reschedule these individuals. The roads were poor yesterday, pretty much throughout the day. And so what I have prided my team on, luckily contact tracing is not as busy right now. And we're able to use our contact tracers and make a personalized phone call to all of the seniors that had an appointment and reschedule them. And I've heard nothing but positive feedback from this group. If you're 85 years old and having to get out at 7:30 a.m. to get your car cleared, there's increased risks for falls and increased concerns, and you might not have slept well because you're worrying about it. And so giving them that day notice was really important, and it was really a positive outcome from my perspective.
And of course, like as we've been discussing during the briefing today, 4,000 new deaths were added back into the system due to the underreporting. Again, what's your reaction to this? I know that when I saw the graph you put up, December we see a massive jump in deaths. I remember at that time we were seeing 4,000 new cases a week, and looking back on it, do you how has the public health community kind of reacted?
The actual deaths as reported now seem a lot more in line with what we were seeing nationally, and so it makes a lot of sense. Unfortunately, death data is not controlled at the local level. It comes from us. It comes to us from the state. I think the thing that we always need to remember is that often folks forget how deadly COVID-19 is. And when you look at the age demographics, yes, individuals that are over 80, yes, individuals that are over 65 are more likely to get serious illness and pass away. But as Commissioner Driehaus and Commissioner Reese both shared, folks that are 35, like the deputy whose funeral they are heading to, he passed away. And, COVID impacts the entire community. And while younger individuals are less likely to pass away, you are not immune from it. So the messaging that we've been saying throughout about wearing your mask, social distance, keep sick at home, and washing your hands, it's really true. And if we all come together as a community, we will reduce deaths in Hamilton County.
And here's my final question. You mentioned that 12% of the population within the county has been vaccinated so far. When you say that, are you saying that they have been fully vaccinated with both doses?
No, that is the first dose. And I don't actually have the number. It's available on coronavirus.ohio.gov's website, the state's website. It is much lower. I want to say it's like 3 or 4%. But the good news is even one dose of vaccine provides immunity. Doesn't get you that full 95% immunity, but it is a big step towards creating immunity within our county.
Okay. Thank you very much, Greg.
Next question is from Chris Wederick.
Good morning, Chris.
Hey, good morning, Greg. Some of the audio got garbled, so I apologize if this has been answered already. But what do you think, or what's your estimation of the root cause of the under-vaccination of African Americans in the county, and really generally, I guess?
So I think there's a few things you need to keep in mind. The very first several weeks of vaccinations were very much dedicated and directed towards those in 1A, our healthcare workers, as well as our firefighting EMS workers and paramedics. As we opened up to the general population, that's where we start to try and make sure that we have completely equitable distribution. So in Hamilton County, we have vaccinated successfully about 11% of our Black or African American population when you look at the total vaccines given. And the total population in Hamilton County is about 25%, so that's really the target and the goal. And so we're making sure as we move forward that we're very conscious about getting vaccine into the community. The truth is, though, we've just not had a lot of vaccine, so there's really not been a lot of opportunity to use targeted campaigns when you're only seeing a few hundred doses each week. But now that we're starting to get bigger allocations, we can make a much more defined and targeted effort.
Okay. Just a second here, Greg. And in the overall equity plan, I think I may not have heard the whole thing. Is there a one-sheeter on that, or a press release that explains the whole thing?
Probably the best spot to look is during yesterday's county commissioner meeting. I had a slideshow that walked through health equity and some of the efforts that my agency is specifically working on, as well as working on with many partners.
Okay. Thank you. That's all I have.
Absolutely.
Our next question comes from Mark Wirt.
Good morning, Mark.
Good morning. Good morning, Greg.
Speaking, I'm having a hard time hearing you.
Can you hear me better now?
Better.
Okay. Chris asked the question, one of the questions I was going to ask, so I'm going to move on to the next one. I'm going to come back to variants. I know I asked you last week about it. Any new reconnaissance on variants locally? I know that Rich Lofgren said that there's a group of labs working on it across the state. And then we had additional cases across the river yesterday. Any new signs here?
We have not in Ohio identified any variants to date. That said, I think I shared last week, our medical director, Dr. Steve Fagans, mentioned it's not a matter of if, it's a matter of when we will see those new variants in Ohio. And luckily, the same public messaging holds true about prevention. If we're wearing that mask and social distancing and doing those preventative measures, we're protecting ourselves against those variants.
Thank you.
You're welcome.
Okay. Do have one question that came in by email from Raven Richards. I don't see her on the chat, so I'm just going to ask it for her. Her question is, can anyone talk about vaccinations in the homeless population, or if there is any discussion about that?
So currently in Ohio, the homeless population would be looked at only based on age. There's no mass vaccination effort for anyone that is under 65 at this point in time. I know that many health departments, including Hamilton County Public Health and the Cincinnati Health Department, have brought this issue up with Governor DeWine's office as well as the Ohio Department of Health. But at this point in time, 65 and up are who we are considering vaccinating.
And it looks like John London has an additional 3 quick questions for you, Greg.
Welcome back, John.
Yes, yeah, thanks, Greg. Actually, the variant, I was going to ask about variants, but I think you've answered that. But I would be interested to know what local vaccine providers are saying about their willingness to join the state website for scheduling appointments, because as you no doubt know, they like their own sites, and they were saying initially they were skeptical of joining the state website when theirs were working well. Can you provide any update about those local vaccine providers and what their thinking is along those lines?
You know, I know the state website is still having some bugs worked out and some issues are still being addressed. I suspect after all of that is ironed out and working perfectly, that we'll have better success. I have not heard any statistics on the 50 providers here in Hamilton County to understand which ones plan to adopt and move into that site. Our agency is currently using a competitor to the state's website, which is ArmorVax, and it's working great and it's working well for us. But as other local providers make the switch, we will figure out how to make the switch as well. But at this moment in time, we're kind of holding steady. We're making sure that the other providers that are using the state's website are able to get things working perfectly so that we can offer a smooth transition from the 70,000 people that are registered in total on our website. We want to smoothly transition them into the new site when it's fully ready for us.
Greg, are you able to know or to tell how much vaccine increase there will be over the next few weeks, week to week? Like, do you have that information, or is it just you get it the week before?
Yeah, honestly, I find out on Tuesday nights how much vaccine Hamilton County as a whole will be getting, as well as what allocation my agency will see each week. In addition to what I find out from the state directly, There's also allocations going directly from the federal government to a few providers such as Kroger Pharmacy and Rite Aid. So I don't have those numbers, but they are in addition to the 14,000 doses that I mentioned. In addition, I know the federal government this week is also planning to have some direct allocations to some of the federally qualified health centers that are not receiving vaccine from the Ohio Department of Health. And ultimately, what I say is more vaccine, the better. The more people we can get vaccinated here in Hamilton County, the better off we are.
Do you see a day coming when you will get sort of a monthly estimate? Where this next week you're going to get 20,000, but the week after that, Greg, you're going to get 50,000, and then you'll get 150,000. I mean, do you see that day coming, or do you think this is going to be dribs and drabs like into the summer?
I think the federal government has committed to providing better estimates to states. So as that process gets worked out, I think we'll have a better estimate here locally. In addition, we know that there's most likely another vaccine seeking approval from the federal government. It's a one-dose vaccine. That will have a major impact as well as we work through this pandemic. If we're able to reduce the work by half when it comes to the number of vaccinations we have to give to get someone vaccinated, that will make a big difference.
Well, the Johnson & Johnson vaccine, as I understand it, has been delayed a little bit, sort of like the state website. How deflating is that?
We're just doing the best we can with what we have, and we're going to continue on. As mentioned, we've got 12% of our population started on the vaccine program, and I'd love to have us at 50%, but we're going to take what we have, and we're going to make the best with it and continue to work with our community to get everyone vaccinated.
And you have no way of knowing right now to estimate when we would hit that 50%.
Nope, no way. It really is a function of the vaccine allocation to the state of Ohio and ultimately Hamilton County.
Greg, thank you.
That would appear to conclude our questions.
Well, I appreciate everyone logging in today and watching the briefing. We will be back same time next week. Thanks.